Autotest VIH is a CE marked screening test for HIV, reliable for the detection of an infection occurred at least 3 months ago. You can do it at home, confidentially. Before starting the test, make sure that you have a timer. Get settled and drop off the unfolded instructions for use in front of you and verify you have all the contents. A test stand, a disinfectant swipe, a sterile pad and a foil pouch containing a test device with a buffer cap, a safety lancet and a bandage. All these contents are for single use. Place the test stand on a flat surface. Gently pull on the buffer cap to separate it from the top of the testing device. Drop it into the bottom of the test stand using your finger. Before pricking your finger, wash your hands, preferably with warm water, and dry them. Open the packets containing the disinfectant swipe and the sterile pad. Swab your fingertip with a disinfectant wipe and wait a few seconds for the finger to dry. Place the red end of the lancet onto the side of your fingertip and press down firmly to prick your skin with the needle. When the safety lancet is used, you can't prick yourself another time. There is no risk of injury. Gently squeeze your finger to form a first large drop of blood. Wipe the drop away using the sterile pad. Without pressing too hard, gently squeeze your finger once again to form a new large drop of blood. With the testing device pointing downward, form an angle of 90 degrees and touch the drop of blood with the tip of the device until the pointed end has filled with blood. Insert it firmly into the stand to puncture the foil cover of the buffer cap. You will feel it snap through 3 times. Check for a pink stain that will start to appear less than a minute after the test device and buffer cap have been snapped together. If the pink stain appears, it means that your test is in progress. Write down the time or start your timer. If the pink stain does not appear within 1 minute, push down more firmly on the test device to insert it completely. Then start the timer. Apply the bandage to your finger. Wait for 15 minutes before reading the result. Be careful, do not wait longer than 20 minutes to read it. To read your results, place your self-test on the space indicated on the instructions for use. If one line appears, the control line, your self-test is negative. You are probably HIV negative if your last risk of HIV exposure occurred at least 3 months ago. If 2 lines appear, the control line and the test line, your self-test is positive. You are probably HIV positive. You have to verify your result with a confirmatory lab test and to consult a doctor as soon as possible. Until the results of your confirmatory test, it is advised to use the means of prevention available, male and female condoms, to avoid taking the risk of contaminating yourself or other people. If your results do not look like the above example, the result is inconclusive. It's not possible to draw conclusions from this result, and you will need to do another test. Be careful, autotest VIH is only able to detect HIV infection and cannot be used as a test for other sexually transmitted infections. Do not hesitate if you need support or guidance, help with using the test or interpreting the result, or any questions related to HIV or other sexually transmitted infections. Don't forget that you can call us at 0800 840 800, 7 days a week, 24 hours a day. The call is toll-free, confidential and anonymous.